What if the patient's bleeding? I know a lot of people, they like doing paramedic reviews because they have a difficult time with testing. Now, let's say that you're taking an exam and the exam states that you're responding to a 26-year-old who was involved in a motor vehicle accident. Upon arrival, patient's found unresponsive, shallow breathing, patient's pale, and the patient is bleeding. Is there anything that you as a paramedic need to know about that bleed before you can answer that question? What kind of bleed does this patient have? And is it worse than my patient's lack of breathing, right? We said this patient's pale in color, maybe cyanotic, has shallow respirations, but the patient's also bleeding. Now, bleeding control is pretty quick. And everyone knows that, hey man, I can go ahead and just hold direct pressure and try to stop that bleed. A lot of people taking a test are going to opt and say, yeah, man, I'm going to stop the bleed immediately. What if I told you that bleed was not severe? What if I told you that bleed was venous bleeding and it was just some mild to moderate bleeding coming from the patient's forehead, but the patient's barely breathing? Which one takes precedent? Providers, you have to be able to say, hey man, that bleeding is not life-threatening and that breathing is life-threatening. We need to be able to fix breathing before bleeding when needed. Now, if I said, or if you're taking the test and the test states that this patient has what appears to be an arterial bleed with severe bleeding, that's spurting, bright red blood, it gives you the whole thing. Yes, that needs to be controlled first. So you need to be able to, when you take a test, to say, hey man, this takes priority.